everyone. I'm Barbara Phillips with Nurse Practitioner, Business Owner, and we've been working with NPs since 2007 on the business of being a healthcare provider. And I have Don Self with me today to talk about ABNs. And so I'm going to let Don get us started.
Well, thank you for allowing this. And I've been working with physicians for about 38 years, physicians, nurse practitioners, PAs, and billing managers on the areas of reimbursement. So thank you, Barbara. So how can we get started today? You have a question about advanced beneficiary notices?
Right, I do. And here's the thing. A lot of times people are a little bit confused about when they can be used, who they can be used with. So why don't we start out with just what are the ABNs? What are they and what is their purpose?
Okay, the Medicare ABN came out, I think, about 1992, if I remember correctly, and it's basically saying this is an advanced beneficiary notice. They wanted to make sure that if a patient is going to be billed for something that Medicare would pay for under different circumstances, but they may not be paying for it today, that they want to make sure the patient knows it. So, in other words, what an ABN is. An advanced beneficiary notices gives an advance warning to the patient that a service is about to be given that Medicare will probably not pay for in the opinion of the medical provider.
Don, if we only are using it if we think that someone is being seen today for something that may not be covered in this particular scenario, what about if we are seeing somebody and they want something we know that Medicare is not going to cover? Well, is the ABN appropriate then as well?
That's a good question. An ABN is only appropriate is if Medicare would pay for today's service under a different circumstance, diagnosis, frequency, etc. If a service is never paid for by Medicare, then an ABN is not required. I do recommend that they use some modified ABN so that way the patient signs it prior to the service being done. And if the patient or the patient's family later says, well, my family member did not know they were going to get billed, you could say, yes, here is where they signed, and we had them sign it prior to doing the service. And that should help you explain that to especially family members or forgetful patients.
Right. And I think that's a good idea just to have that anyway. So let's just say I'm seeing somebody today. We're going to do something that is not going to be covered today. I have them sign that ABN. When I go to bill Medicare, do I need to indicate that service and somehow also indicate that there's an ABN on file?
Yes, ma'am. There is a GA modifier in that instance that you would go ahead and bill Medicare, but you would have the GA modifier afterwards. I can give you a good example of when we would want to use an ABN like that. Let's say a patient comes in and they're tired and they're fatigued and they ask for a B12 shot. Well, a B12 shot would be covered by Medicare under pernicious anemia. It's not covered for fatigue. So you would explain to the patient, Medicare is not going to pay for this because you don't have the diagnosis they need. Do I, as a medical provider, recommend you have it? Yes, we believe it would help you. But if we're going to give this, you need to sign the ABN prior to us doing the service, and then we will go ahead and file the claim to Medicare, and we would assign a GA modifier to it.
Okay, and so then the EOB comes back showing, yes, it would have been denied or whatever the case may be, and so that everybody's good.
Exactly.
What about using the ABN form with other carriers?
Great question. The Medicare is the only one that has a requirement, and that's Medicare Part B, has a requirement for using the ABN. As far as Medicare Part C Advantage plans, it's not really legal to use the Medicare form in its own original form that Medicare publishes. You can use a modified ABN and use that with any kind of an insurance, whether or not it's Medicare Part C, commercial insurance, etc. but not the original Medicare form that has the letters at the bottom of it that shows that it's a government form.
So then in this case, I would just create a form that says basically the same kinds of things. This is not covered by your carrier. You're going to be charged today, and that sort of thing. Okay.
Exactly. Now, the problem is also that during this public health emergency, services that would not normally be covered under other conditions are now covered. So it's tantamount to that the medical provider stays on top of what's covered that would otherwise not be. As an example, telephone calls. Prior to the emergency and President Trump issuing that directive in April 12th of 2021, saying that telephone calls will now be covered, they were not covered for just a regular telephone call to a patient. So in that case, you would not use an ABN back then because they were never paid for it. Codes 99441, 42, or 43. But during the public health emergency, those are now paid for by Medicare. So it would not be appropriate to have the patient sign an ABN and file that with a GA modifier because it is a covered service, unless the patient was going to say, I wanted a phone call about something that's non-covered and non-medically issue, no medical issue. What is that? Well, I want to talk to you about my genetics of my great-great-grandfather. That's not going to be paid for by Medicare. In that case,
Right.
You would use an ABN.
Right. And with the public health emergency coming to an end, at least as we think it is coming to an end here shortly, then again, it'll be a non-covered issue. So we don't have to use it for that. Okay. Is
Correct.
there anything else around the ABNs that practitioners should know about? I haven't asked you.
Well, yes. Whenever you have the patient sign an ABN saying that I recognize that Medicare is probably not going to cover this, you're allowed to go ahead and collect your fee at that time from the patient. You do not have to wait until you filed the claim to Medicare and gotten a denial.
Great.
And then the question comes up, how much of a fee? Are you restricted to your normal fee? Or are you restricted to the Medicare physician fee schedule or the allowed amount, as most people call it? No, it's whatever you would normally charge your non-Medicare patient typically. Can you give the patient a break and say, hey, I want to charge this patient less because I know they live on fixed income? Sure, you're not required to charge a certain amount, especially with the patient paying cash. You can charge anything you wish to.
Okay. Excellent. Thank you. I'm glad you brought that up. So good. I appreciate you answering all those questions on the ABN, Don. And for everybody who's watching this, if you're watching us on YouTube, follow our respective channels and leave us a comment and a like.
Thank you so much, Barbara. I appreciate being a part of this with you.
Thank you. And we'll talk again soon.
Yes, ma'am.